I think what is really refreshing always when I speak to you both is that you never feel like there's any judgment about what we don't know, because we don't know this stuff. And
You don't. Consciously incompetent. You don't know what you don't know.
Completely, Sandra, yeah. And it's been okay with being able to come to you and say, I have no idea what I should have in my practice. I know that there is holes. And I think you two both offer this very non-judgmental, lovely way, about how you run your company. That means that you can just fix the gaps, you can plug the gaps without making us feel like we're failing
Absolutely.
in some way.
Yeah, absolutely.
Welcome to the Treat Your Business podcast with Katie Bell. I am Katie, and this is the place to learn the strategies, tactics, tools, and mindset needed to build your clinic or studio into a business that gives you the time, money, energy, and fulfillment you want and deserve. My team and I work every day with overwhelmed and exhausted clinic owners like you to shift them from a business that is a huge time and energy drain and is not giving them the income they want, to confident clinic owners that are making money, saving money, and getting time back in their lives. So if this sounds like something you want, let's dive in.
Hi, Sarah. Hi, Sandra. Welcome to the Treat Your Business podcast. Thank you for both being here.
Thank you. It's lovely to be here. Lovely to be here.
I'm excited to see you both and to talk to you and pick your brains on behalf of all of our listeners around everything to do with compliance, as much as we can possibly squeeze into a 20-minute episode. First of all, Sarah and Sandra, I know who you are. You are gorgeous ladies. Can you tell our listeners who you are, what you do, and who you work with?
Yeah, I'll start. So I'm Sarah. I'm a physio by background. We set up the business together because we spent a lot of time working together in a big organisation auditing private physio practices. And we found out that physios didn't know what they didn't know. And so we really enjoyed helping them to get to where they needed to get to, because at that time we were referring a lot of our patients to them. I used to work on inpatients. I used to drive the length of stay down for hips and knees. And that's what I really used to enjoy. And then latterly, I'm also doing this business, but I've also trained again as a psychotherapist. So I've got two businesses.
So,
yeah. Yeah.
Okay. That's so exciting. Sandra, over to you.
Yeah. Hi. So, much as Sarah said, my background is MSK, outpatients. I run a private practice. I've been involved in elite sport before Sarah and I worked together, and we just got inspected so many times when we worked together through various bodies. We just found that people just didn't understand this stuff. Hence why we moved to where we are. And I also have a joint role. I obviously do HCPG with Sarah, but I actually do portfolio work. So I've done trustee and board work in the NHS, and currently I'm working with charities in the health and social care sector, which is equally interesting. And again, loads more compliance.
Absolutely. So you've got, not only have you lived and breathed this stuff, you really understand it from a clinic owner's point of view, don't you? And I think what is really refreshing always when I speak to you both is that you never feel like there's any judgment about what we don't know, because we don't know this stuff.
And you don't.
Consciously incompetent. You don't know what you don't know.
Completely, Sandra, yeah. And it's been okay with being able to come to you and say, I have no idea what I should have in my practice. I know that there is holes. And I think you two both offer this very non-judgmental, lovely way, about how you run your company. That means that you can just fix the gaps, you can plug the gaps without making us feel like we're failing
Absolutely.
in some way.
Yeah, absolutely.
Yeah, often, Kate, you've got this stuff as well, haven't you, Sarah? People don't know what they've got, because if you don't know what you don't know what you've got and how to use it.
Yeah, absolutely. So when it comes to compliance, I'm going to ask a big question to start with. Why, if we're not being audited or investigated, why do we need to look at this stuff?
Okay, I'll start on this one. So we don't fall under the CQC, because in order for that to happen, there'd have to be a change in the law, because everything in the CQC falls out of the Health and Social Care Act. So they exclude physiotherapists. Goodness knows why, but they do. So we're not inspected. And you can go from training through to starting a private practice. You can work all of your life in a private practice and not do any CPD. And unless you're pulled by the HCPC, and only 2.5% of the profession are pulled, you can have not done anything at all and still be practicing. And the public think that if you speak to any member of the public, if you go to Physio and tell them that actually we are regulated by the HCPC, but nobody checks, they are quite shocked, because they would assume, like going to a doctor or a dentist or anything like that, that you're going into a safe environment where somebody is checking you. It's not the case with physio. We absolutely fly under the radar. So, of course, you cannot do it, but every time that you sign to re-register, the ethics and the compliance around those standards is that you sign to say that you adhere and follow them. So you can do that, and you can just tick the box and say that you do, and nobody will actually do anything about it unless there is a complaint or you're taken to the HCPC fitness to practice. There is a lot of apathy out there about, well, I don't think I need to bother to do this. But we come from the aspect of, why not do this? Why wouldn't you have to have the best practice you possibly can clinically and from a compliance perspective?
And so the thing that we say, Katie, as some of your members might know and some might know, we do a newsletter. We call it La Cucina, the kitchen. Because, and I've come from running a high street clinic and various other things. And yeah, as clinicians, and I still do a bit clinical, we love treating patients. We love being front of house, 5-star food on the plate, proms, prems, whatever it is, patient satisfaction. We do that bit. We don't really like doing the pot washing in the kitchen. That's not where we are. And what we say is the stuff that we work with you on is help you get your pots clean. You don't want to put food on a plate that actually isn't safe. And underneath all of this, as Sarah said, safe is that key word, safe and ethical, because this is about, are you safe? Are your team safe? Is everybody safe? And if something, you need to evidence it, how would you? And I think we were going to use today a quote, if you don't mind, from one of our partners, who basically, he was saying to us that I think the sooner people realise that they aren't paying us to pick out gaps and point fingers, but to work with them to help them grow their business, then it should sit differently. It is everyone's responsibility as an HCPC member to ensure that their practice is safe and that everything is ethical. That sums it up. Everything we talk about, whether it be, people talk about policies and processes, and people say, oh, you don't need this, you don't need that, and the training. Everything we talk about comes from 4 things if you're a physio: HCPC conduct, performance and ethics, HCPC proficiency, CSP quality assurance standards, or the CSP code of professional values and behaviours. So these things are all in there.
Yeah.
And what we say to you is, you've probably got stuff around them, but if you're not sure, come and have a chat. Come and talk about it. Find out what you've got and how you could use it. And if you haven't got something, we can talk to you a little bit about it and make some suggestions. But don't just get something and put it on the shelf. That doesn't look after you. This is about living, breathing, thinking about it and making it business as usual. And it's legal, some of it as well. So there's a legal side. Sarah, do you want to talk legal?
Yeah, so there is quite a lot of noise out there about, you don't need policies and processes, you don't need this training, these lists that you don't need any of that. That is a real message that's out there. But there is a requirement for you to follow the legal aspects of our profession. And the HCPC states that you have to follow the legal requirements. You have to follow the Information Governance Act of 2018. You have to follow Equality and Diversity. You have to follow the Mental Capacity Act of 2005. These are all things you have to do as a competent, good physio. So they say you don't need policies and processes. You can do it in any way that you like, but you have to be able to evidence that you understand it and that you do it. And actually, rather than it being a burden, and all of our partners who we audit with say at the end, they say, I really get this now.
Yeah.
I really understand this. And this helps me in my business, because I just have got processes for things. Nothing really phases me. If we were to get a complaint, I know what to do about it. If we had an adverse instance, I know what to do about it. They just feel so much more secure and safe.
Yeah. And this reminds me a lot of when we did a house extension in COVID. And for weeks, I was spending money on things that I couldn't really see. Like I was coming home and my husband saying, we need to pay the builders another X amount of thousands of pounds. And I'm thinking, what are they doing? All they're doing is just making more mess and more holes. And then the weeks went on and we got those foundations in place, which were really stable and really rock solid. And then we built this beautiful, huge house refurb over the top of it. And it was all wonderful. But without that solid base, we wouldn't have this great house and that I can sleep in at night and not worry that it's going to fall apart. And so I think sometimes, I'm coming from a business owner's head, they go, oh, this is money that I've got to spend on stuff that I might not ever need. Yeah. But you wouldn't say that about a house extension, would you? You would have to invest in those sorts of things. And I think, I don't know whether you have felt the same, but since COVID, I think we've had a change in patient behaviour. Yeah. In that people are tolerating less, they're expecting more, they are looking for a higher level of care and regulation, and they are doing their due diligence more and more.
They are.
Absolutely. I think that's right. And I wouldn't ever worry about somebody doing due diligence on us, because if you've got your foundations in place, you're like, okay, this is fine. All these people that just can start a practice and never do CPD or any of this in their life, that are ruining it for the good people, all the people that work with you that do care.
And we have a lot of physios that really do care.
Yeah.
They really do. Yeah, they know they don't have to do it, but they want to do it. And they also want to stand out as a really good clinic, as an outstanding clinic. They want to stand out and raise their head above the parapet and say, look, and shout about what they do. And we have a lot of those. But also we go right down to just have a call with us, come and chat. We have quite a few people who just phone us up saying, I've got this problem, I can't think, what do you think? We do a lot of troubleshooting with people as well.
Our business is a lot of it, Katie. It's really, people say, oh, that's the policies and procedures, ladies. We're not. We're about education and advice. You can have a lovely piece of paper, but if you don't understand it, you don't know how to use it, and you haven't got that everything sitting around it, then what use is having a piece of paper? So we're about, how do you get the education? How do you get the advice? What do you need to understand? Yeah. And then you can go and look at your business differently. Yeah. And as you say, we talk about being a bit of a safety net. It's that scaffold that sits, as you say, that foundation that's sitting behind there on which you're building everything else.
And this is similar to when clinic owners get into a position where they've got team, that we have to then invest in HR. So we have to then think, oh God, more policies, I need more procedures, I need more of these things. And it might not ever be because you ever actually need to use them, but it's like, what happens if, and I don't have evidence and I don't have a robust way of saying, this is our policy for this, and this is why we need to move you from the business, for example. So it's that whole insurance policy mentality, isn't it? That how much do you want to know that whatever happens in your business, because things will happen inevitably, that you're protected, you can sleep at night, you've dotted the I's and crossed the T's. And so how often do you have conversations with people who are not compliant at all? Like they're just got huge gaps, and you think, oh my goodness, where do we start with this?
We find that most people who come and bite the bullet and say, look, I've taken my head out of the sand, and because we are very supportive. We're not fault finding at all. We're here to support and help. So when we do a first audit, very few people get above 30%. Yeah. So there's a lot of people out there who don't know what they don't know. So it gives us huge pleasure and pride to help them get to that point of that you have to get over 90% compliance to be able to get a certificate from us. So we work with them until they can get that, and then it's just lovely to see, isn't it, Sandra? It's lovely to see. But I think I want to throw it back at you, Katie, a little bit and think, why do you think physios don't do it?
Yeah. Why is it less important?
Because it's not an absolute must. And then I think it's the wrong thing. Like, well, we should be CQC registered, in my opinion. We are a regulated body that is the most unregulated body ever.
Yeah.
And I think there's all of that there. But I think it's because 99% of the time you'll get away with it for so long. And so it becomes something that you just push down your priority list. And if you don't start with it and your business grows and scales, and you're now starting to think about marketing and sales and team and leadership and finances and projections and all of these other things, and compliance just goes, oh, here, because there's always, in a clinic owner's mindset, I think always something else that feels more pressing.
Yeah.
Because if I don't fix my sales process, I can't pay myself this month. If I don't deal with this team member, something is going to happen. Whereas if we had more episodes where we were having to evidence we were compliant, this would be well up there on the to-do list. But most of the time, people fumble the way through, and most of the time, people are okay. If I think about the amount of times we might have had a complaint in our clinic, like we've been going 10.5 years now, probably less than 5.
Shall I pick you up on that one, Katie? It's something that really interesting Sarah and I found last year, and it fits into what you were saying earlier about society changing.
Yeah.
Last year, our partners had 10% more complaints than before.
Huge.
And 90% were fine, but 10%, which is, as you say, it's big, and it's just where society, as you said, they expect more, quite rightly.
Yeah.
But if you don't meet that, then they complain more.
But also the other thing is that with the CSP, they focus on the NHS. There is a move now to think more about private practice, but private practice is 20% and they deal with 80% in the NHS, so they don't really bother. When you have a clinical incident or a complaint and you work in the NHS or the independent sector, they pick up the tab. They cover it, they pick up the tab, they do everything, right? So it never gets to James Hallam. But the 20%, right, go to James Hallam through the CSP. So that's why and there is no openness about how many complaints they get and what types they are.
Yeah.
And how much they actually spend on sorting it out.
Yeah.
There is no openness. The osteopaths cannot deal with a complaint before they contact their insurance. They have to contact them first, and then they deal with the complaint. So the osteopaths know exactly how many complaints they have and the type. But we don't. We really don't.
Why are we such a non-transparent sector?
Exactly.
It's mad.
Yeah. And so the osteopaths do research on it. And so you can learn from it, and you can share the learning, and you can grow with it.
Yeah.
But we don't, there is no transparency.
And so therefore, again, it's another, nobody's really talking about it. Doesn't seem to be that big of a problem. So I'll just keep burying my head in the sand and dealing with the other stuff.
Well, the thing is that if there is a clinical instance or complaint, the insurance will cover it, but there's nothing about what your reflective practice is, how you're going to change, nothing, just covered, carry on as normal. Unless you go to the fitness to practice, and then they might put a suspension or a supervisory order on you. So it's not transparent.
And it doesn't encourage people in the same way at all, does it?
No, it doesn't, because I think physios, you work with more than just physios, but if I'm a physio, you're both a physio. We are a certain personality type, and I think we are high achievers, we are doers, we are worker bees, we want to get stuff done. And I think because we're high achievers, we do want to be great at what we do, and most of us do want to be compliant. When we ran the HCPC update for Physio First 2 years ago, whenever it was, a few years ago, we did that workshop. So many people were at it.
Yep.
Because so many people care. So I don't think it's an industry that doesn't care about patient outcomes and doesn't care about how we are running our business. But I think it's just being squashed by probably no transparency, it not being talked about enough, it not being made more regulated than it is. And as you said, Sarah, the insurance will just cover it, and then that's it. You just move on and get back to it the next day.
Yeah.
So the message is leave it. The message is leave it. And we're saying, we can't leave it because it's there. It's in the regulations and the standards that we've to work to. But if you don't understand the regulations and standards, then it does mean there's this knowledge gap. And that's what we're trying to do something about.
I think that this is a problem is grassroots the right saying? From like university stage.
Yeah.
Like
we were never taught. You never taught the business side of it. And you never taught the compliance side of it.
No.
You just come out and you just have to wing it. So we're not taught about the compliance side at all. And so you can come up, set up a private practice, be a clinician, and never have to really think about the standards, you just tick the box. Oh yes, I apply, but I adhere to them. Yeah, because I'm a
Yeah.
physio. I'm very honest. I've got a good character. Yeah. I'll just tick that box.
But then we get the ones who come out. And then the other thing is people go into the NHS or the independent sector where actually it's there, it's done, you're part of that. And I think sometimes people forget that when you step out of those sectors, it doesn't mean those regulations and standards change. It's just you're in a different position about the way you work and you understand them and where the responsibility and accountability comes. And so I think if the education isn't there, people don't quite know what to do. And sometimes people don't want to say. Sarah and I say that people will say to us, I didn't really like to say I didn't know this. And we're saying, but we don't judge you. We know a lot of people don't know this. That's why we set the business up.
And this then makes me think about those that have got, like you were saying, the NHS have got that framework there. It's you live and breathe it within that in that framework. Then you go and set your own practice up and you are responsible for you.
Yeah.
And then because you're just responsible for you, you think, I'll just not look at that for now. But then you get some team members, you get some newly qualified, and you build your clinic. You become responsible then as the clinic owner of building that framework of compliance for the others, don't you? Because the likelihood is they're coming into your business and they don't know it either.
Yeah.
And one of the things that like really, really gets me annoyed is this whole notes thing. We are told, aren't we? We've got to write clinical notes within X amount of time of seeing the patient, and you've got to write it in this format and that is a standard, isn't it, that we have to adhere to. And one of the challenges you've always got as a clinical lead or a business owner is when your staff don't meet those expectations. For whatever reason, you've got to deal with all of the reasons that come underneath it. But you're then like, this isn't just me being a business owner giving you really strict rules. These are actually what you have to be doing. I've not just made them up. This framework already exists.
Exactly.
And you have to be adhering to it. But they don't often know any of that stuff.
No. It's this unconscious incompetent. Again, back to that piece, that people don't understand it.
Yeah.
But who has sat down and looked at them all in the way that we do?
And then they renew them and review them and change them. And
but at the end of the day, Kate, as well, if they don't do their notes and you as a clinic owner, you're onto them and you're doing the training and all the rest of it, getting up to date. If there was a complaint or it went to the HCPC fitness practice, they're on their own.
Yeah.
The clinic owner isn't going to come with them. They're on their own because they're a professional in their own right.
Yeah.
So they then have to be able to stand up in front of the fitness to practice and say why their notes aren't as good as they should be. So they do fall out. I work for the clinic there, but they are practitioners in their own right.
And, so this is just so great because it's going to make, first of all, I think most of our listeners will go, oh, okay, most people don't even score above 30%. This makes me feel better about my situation and being more open to having a conversation with you both.
Yeah.
But what would be your first top tip? The first thing, if people are listening to this thinking, this is me, I need to pull my head out the sand. I don't know whether I am 50% compliant, 80%. I just don't know. What would be the first step that you would advise them to take?
Come and talk to us. Come and talk to us. Just come and talk to us, because until we know what you've got and how you're using it, then we can't give you the advice and the education. Yeah. And people have got things, Katie. It's very rare to find people with nothing. Otherwise, they wouldn't score. So people have got things, but often it's something that they've just picked up from somewhere or they've cut and pasted it from someone else, and they don't actually understand what they've got. So come and have a chat with us. We're not judgmental at all. People will tell you that. We're here to help, but we can't help you. Tell us what you've got.
I remember Sandra, it was Sarah, I can't remember if it was you or Sandra that said on one of our training sessions together, or something we've done together, that you said ChatGPT and the place it is now holding in lots of people's businesses, for good or for bad, is not going to cut it. It's not going to cut the mustard, because I feel like you said you could just get ChatGPT to write your policy, but if you have no understanding of that policy and you cannot evidence how you are putting that policy into practice, then it wouldn't stand up in court, or it wouldn't support you.
It wouldn't stand up in court. And if we were ever inspected, having been inspected myself as a registered care home manager, I was a care home manager and had 2 CQC visits. They go into everything.
Wow.
Everything. 2 days they were in there, and you won't get away with anything. Yeah.
So don't chat GPT a policy and think that's going to cut the mustard. They need to come and talk to you.
And it's bespoke. It's bespoke, isn't it? So that's what we find. But no two clinics are the same.
So, for example, you can go onto ChatGPT, get an informed consent policy. Yeah, read it, everything. But you really need to understand how to gain consent in children, because that's a minefield, right?
Yeah.
You have to understand how to gain consent in somebody who's lacking capacity.
Yeah.
Understand your whole process is around not just having a policy on a shelf. Oh, I've got the policy, I get informed consent. It's about patient information leaflet. It's about explaining to the patient. It's about making sure that you document it in the notes. It's doing all the risks and benefits. It's a whole thing.
That did we do a webinar? That was
I did a talk with you
about informed consent.
Yeah.
And from that talk, I went into my clinic and I was like, okay, what we thought was okay is not okay. We completely changed how we do things now. Like, I thought what we had was good. And then just some of the things that you said to me, Sarah, I was like, this is not okay. This is not right. Now we do risks and benefits. We've got so much more stuff there for if they're lacking capacity, what's the process that happens. Yeah. We've got it all evidence. We've got it all there. But I'm unconscious incompetence. I was like, I thought that was okay.
Yeah.
But what we've done, Katie, is like you're saying, you're unconsciously incompetent. We made you consciously incompetent.
Absolutely.
Now you did. You're about it. I was just going to say, now, would you feel confident saying you get true informed consent?
Yes, I would. Whereas before, if you'd asked me, I'd have gone, we have an informed consent policy. I know that's what we should be doing. We tick a box, we do this and we do, but actually, until I was made more aware of people who actually know what they're talking about when it comes to the policies and the procedures and what we should be doing, I wasn't aware of the depth of what I needed in the clinic. And this wasn't like a massive thing that took me years to implement. And I just had to make some small changes.
Small changes.
Yeah.
And your team all benefited from it. And then you know that if you were ever called into question around, did you get consent? This is all my evidence. Look, this is my patient information leaflet. This is my policy. This is my risk and benefit sheet.
Yeah. And that makes you sleep, doesn't it? Ultimately,
it does. And the solicitor, though, if he goes to court, they're going to think this is a real professional. This professional knows what they're talking about.
Yeah.
So that your word and the patient's word, it will probably go more in your favour. I couldn't say that, but they will look at your professionalism. And when you've got all that in place, they're going to think this physio knows what she's talking about.
Yeah.
Yeah.
And I think that was what we heard, wasn't it, with the HCPC, that if we were to be audited, if you were going to rock up to that with zero evidence, zero history, nothing ever documented, they're not going to look favourably on you. But if they see that you have attempted and tried and done things, they'll be like, okay, this person does actually care. They've just got a gap here. And they'll give you time to fit the gap.
Exactly.
Yeah. And if you think of what you've just said as well there, Kate, if you were to do the HCPC portfolio, think about what you've just told us about and all the stuff you've done around the consent standard and all the evidence you've got. You're well on your way, aren't you? If you were pulled in 2026.
Absolutely. You've got it there. And last time we talked about on our HCPC thing, just start documenting, like listening to this podcast.
Yeah.
You can evidence, you can put the hyperlink into the podcast, you can write a reflective piece about what you learned. You could do an analysis of where your gaps are, and your action point was to come and talk to Sarah and Sandra. And one thing,
because I was called for the CPD thing about 4 years ago and had to do it. And of course, I'm not treating patients anymore. I'm doing this business, but I talked about our business. I talked about everything we do, everything we do, and I passed fine. So it doesn't have to just be clinical stuff. You can bring in this sort of stuff. And it will be absolutely fine to do.
And the beauty of bringing it in is it gives you two things to talk about. So you've got your clinical side and you can have this side. And then it means easier writing your word count. You've got a really good focus on the business side alongside the clinical side.
Yeah, it ticks loads of boxes, doesn't it? So they need to come and have a chat with you both. How do they do that? Do you want them to email you? Do you want them to go on your website? What's the best way for them to reach out?
They can either go to the website, which is obviously very simple, www.hcpg.co.uk, or they can email us. And that's equally simple. It's either Sandra@hcpg.co.uk or Sarah@hcpg.
There's a book a call on our website. There's a book a call, and it just takes you straight into our diaries, and you can just book a 30-minute call with us.
And also on the website, Katie, there's a link they can click on to get the newsletter with some tips.
Oh, yeah. And I'm on that newsletter. I get it every month. It's great. So I would really encourage them to do that. I'm going to make sure that those links, Sandra and Sarah, are in the show notes. So listeners, just scroll down on the platform that you're listening to, and you can head to those links and get your call booked with Sarah and Sandra, because it will, I think, that it will be scary for them to do it, because it's that acknowledgement of failure. Because we're high achievers, we don't like to be told that we're not doing anything really well. But also that just after that moment of being vulnerable and saying, I need help here and here, you guys then just kick into action and scoop them up and help them work through it.
Yeah, we do indeed.
Great. Thank you both so much for your time.
It's a great pleasure.
Loved this conversation.
We love talking about it. You know what we like.
Thank you. And please come back again soon.
Lovely. Thank you very much.
Thank you for having us. Bye now.